Welcome to an interactive view inside of the respiratory system. For engagement purposes, we'll be pretending as though we're working aside head nurse Jasmine Weaver at your local urgent care center. In front of you, you should have your interactive notebook, which will help you recall specific information that'll help you deal with the patient for today. When you see a question in black flash across the screen, we're going to ask that you stand up quietly and wait to be selected by one of our group members. Once you're selected, you'll have 5 seconds to answer the question. Be quick. So keep your eyes peeled and that oxygen flowing, because there will be rewards for being at the top of your game. Before we meet our patient, we're going to take the time out to review the organs in the respiratory system. The nostril, or nose, and the nasal cavity form the main external opening for the respiratory system and are the first section of the body's airway. The oral cavity, also known as the mouth, is the secondary external opening for the respiratory tract. The pharynx, or throat, is a passageway leading from the mouth and the nose to the esophagus and the larynx. The larynx, also known as the voice box, is located in the back portion of the neck. The trachea, or the windpipe, is a 4-inch long tube covered in C-shaped hyaline cartilage rings. The trachea connects the larynx to the bronchi, allowing air to pass through the neck. The lungs are a pair of spongy, air-filled organs located at either end of the chest. At the inferior or the far end of the trachea, the airways split off into left and right branches, also known as the primary bronchi. Inside of the lungs is made up of spongy tissue containing many capillaries and around 30 million tiny air sacs, known as the alveoli. Now that we've got that down, it's time to open your interactive notebooks to Activity 1. On page 1, you'll find the diagram that we just went over with blanks that need to be filled in. You'll have 2 minutes to complete the activity, starting now. time is up. You might want to pay attention to the question that's about to be on the screen. It's going to be worth your while. Your patient has just arrived. Let's take a look at what got her here. Meet Brenda, a heavy smoker.
No, I can't breathe.
Do you have an inhaler? Do you need me to call somebody for you? Okay.
Wait just a minute. Oh. Yeah, call somebody. Hey, Miss Callahan. You feeling a lot better?
Yes, but I'm a little short of breath.
Okay, we're going to take you down for some CT scans and get that checked out for you, okay?
Okay.
Follow me.
All right.
While the patient is gone for CT scanning, we'll review how the lungs work to help us breathe. As we inhale or breathe in oxygen, the diaphragm moves downward. As we exhale or breathe out carbon dioxide, the diaphragm moves upward. This pair of cow lungs is exactly what our human lungs would look like, inflating and deflating. Of course, because the rib cage is not there, these lungs are inflating a lot more than they normally would, but this is just to simulate.
Okay, Miss Callahan, we're going to ask you a quick question before we get your CT scans back, okay?
Yes.
All right. How long have you been feeling like this?
About 2 weeks.
Okay. Okay. On a scale of 1 to 10, how bad or how are you feeling?
8.
Okay. Do you smoke?
Yes.
Okay. Smoke cigarettes, correct?
Correct.
Do you have any previous medical history?
Yes, bronchitis.
Okay. I'm just going to plug this into the system and we're just going to go check on your CT scans, okay?
Okay.
The CT scans are in, but before we get to that, I have one last question for you. Get ready. For comparison purposes, here is a picture of a normal lung. Notice that in this picture between the lungs, the structures are clear. You can see everything has its own lines and their own division. Now, notice with Brenda's CT scan, the lungs are enlarged, and between the lungs, you can't really tell what's what. It kind of looks like it's mushed together, which signifies that there's a very large amount of inflammation. Now turn to page 3 in your interactive notebooks. We're going to do a clue check. What symptoms did Brenda have when she came in? Brenda is also a heavy smoker. What previous medical history did Brenda have? These are all the clues you will need to decide which disease Brenda has. Turn to page 4, where you'll find a few different diseases that involve the respiratory system. Using the clues and what you know, which respiratory disease do you feel Brenda has?
Brenda Callahan, the patient.
Jasmine Weaver, nurse.
My name is Amber Abaney. I am the supporting stranger.
Kayla Lewis, your narrator and videographer. Thank you so much for your hard work and participation.